Hi, I'm Wes, and
I'm Max, and we're here to explain.
how the Gardasil vaccine works.
The Gardasil vaccine protects against human papillomavirus. In more detail, it protects against 4 strains of HPV, 16 and 18 which can cause cervical cancer, and HPV 6 and 11 which can cause genital warts. Gardasil works by injecting the surface components of the virus into a person, which tricks the immune system into thinking it's a real virus. The surface proteins L1 are what activate the immune system. Without the viral DNA, the virus is rendered inert, which makes the vaccine relatively safe.
The vaccine works in 3 stages. First, the vaccine is injected into the patient. The vaccine is composed of the surface proteins called antigens and adjuvants, which are meant to speed up the immune response and are injected into the patient. The adjuvants in Gardasil are aluminum hydroxyphosphate, sulfate, and polysorbate 80. Within moments, acute inflammation and warmth are felt at the site of the injection due to the adjuvant's ability to speed up the inflammatory response. The viral capsid is highly prophylactic, which means it also induces a high initial immune response. Secondly, immune cells, such as dendritic cells, will pick up the L1 antigens and present the surface proteins to T cells. Lastly, the T cells will decide that this is a job for the B cells to take on, and once presented to a B cell with a complementary surface protein, they will make antibodies that carry the ability to neutralize the infection if it ever shows up again. In the event that this virus, HPV, is encountered, the HPV-specific antibodies will then bind to the HPV L1 virion, which will neutralize the virus and prevent it from entering and binding to host epithelial basal cells.
It is important to note that vaccination is a relatively safe and effective way to prevent disease that have little to no benefit in our society. There are risks when being treated with the Gardasil vaccination. Some people can have allergic reaction to the components in the vaccine. That said, the Gardasil vaccine's pros outweigh the cons. A long-term immunity to an unnecessary and possibly life-threatening disease is better than not having one.